Cost pressures are rising, policy is shifting, growth demands precision. At AB+A, we believe smart marketing can drive performance and cost control. So here's a challenge. 59% of healthcare CMOs expect budget reductions in 2025. Yet 73% of their CEOs are demanding marketing prove its contribution to revenue or cost savings. Here's President Tony Baradat with a fresh take on growth through cost optimization.
What we clearly have is an issue of accountability, not expenditure. The issue is, and by the way, always should have been, performance. We've preached that since our agency started back in 1994. The key is tying marketing and metrics. Think about it. What CEO, when presented with a logical, metrics-driven growth plan, with guardrails in place, milestones, accountability, wouldn't reallocate from elsewhere to make the growth happen? Of course they would. It's just a logical thing. Marketing's always been a key growth agent. The problem is, for too long, it's also been a big waste agent. There's been too much wish spending. So when a CEO can't get discernible outcome information on their marketing, the default's gonna be a budget cut. And in today's market space, there's so much outcome projection available, there's really no excuse not to have this be a part of the plan. You should know what you're getting yourself into before it happens.
And actually, high-performing health organizations are 2.4 times more likely to treat marketing as a strategic investment rather than a budget drain. It's really what you're preaching, right?
Yes, we're not making this stuff up. We didn't invent this. I wish we had, but we are perfecting the idea. Our model turns the CEO towards an accountable budget increase, the strategic investment that marketing should be. We want that CEO to change their long-term default for their CMO, their brand, and their budget. Get them to the point where they're always assuming that the plan is solid, geared for growth, and more importantly, that it's going to work.
Now, 56% of marketing leaders report costly duplication across partners and platforms that dilute impact and inflate spend. That sounds like a real problem, especially in the cost-sensitive environment we're in.
Duplication's absolutely an issue, but a few other things are problems as well. You really got to get to the foundation of three basic pillars: waste and overlap, siloed efforts and attitudes, and a precision versus a shotgun strategy. Actually, here's an example incorporating the first two. You have a new surgical marketing initiative, but there's an internal surgical management team plus an overall brand team. They all want different things because they're all driven by different leadership and goals. And you can try to work around all that. You can pretend it's not there, but look, you're really not going to solve the problem until you consolidate that overlap, until you cut the waste, you address the resources, the goals, and the messaging as a whole. That's what we do. We maneuver and we consolidate, and yes, in some instances, we have to compromise. That's how you succeed.
Research shows that personalized campaigns generate 5 to 8 times the return on investment, and they boost engagement by up to 300%.
Yes, that speaks to our precision versus shotgun strategy. We're working in an age of precision, using AI, new digital media channels, intent-driven targeting, and a whole lot more that doesn't even exist today, but it will by next week. That's where it's at, finding and executing the marketing models that work now, and with an eye towards what's being developed, sometimes literally next week or next month. We blend science, we blend insights, and execution. I could say this is simple, but a lot of people really don't know how to do it.
So 79% of healthcare consumers are saying they're more loyal to organizations that actively invest in their community. How does AB+A's gig model work that in?
Yes, this is something we've been telling our clients about for years. Don't keep nice secrets from the marketplace. We're big believers in added media value, and we've used this successfully for clients for years. A perfect example, we created a campaign for a children's hospital for free cardiac screenings for kids. One child was going to try out for a football team, and he learned he had a congenital heart condition that likely would not have ended well. I mean, we saved a child's life because of those free screenings. Healthcare organizations, they do so much good in their communities. They're just not very good at promoting that. We actually created the gig model to integrate our clients' good into everything they do. And when there isn't anything specific, we can help develop that as well. You're always doing something good out there. You should get credit for it. Blend it into the marketing and provide a more complete picture of your organization. Optimize your brand messaging, fire on all cylinders.